Hello everyone, my name is Dr. Manjeet, and in this video we will learn about the insertion of the Ryles tube, aka the nasogastric tube. So it's a tube that's a long polyurethane or a silicone tube that is passed through the nasal passage via the esophagus into the stomach, and they are commonly inserted in the surgical practice for the various reasons. And there are mainly two indications for the nasogastric tube insertion. First is to empty the upper gastrointestinal tract or for feeding. And in this procedure, you must take care of the cases where there may be any case of ear, nose and throat abnormalities, or there could be infection of these, or there could be possible strictures of the esophagus, and there could be esophageal varices, there could be anatomical abnormalities like the esophageal diverticulae, or there could be risk of aspiration, because due to the gag reflex there could be vomitus that could be aspirated and which could endanger the life of a patient. So before beginning the procedure, we need to explain this procedure to the patient in a patient friendly language, and after explaining this whole of this procedure, you should gain the consent to proceed with the nasogastric tube insertion.
जैसे थूक निकलती है ना, बस वैसे निकलना है। अगर ज्यादा वो करोगे ना, फिर ज्यादा दिक्कत होगी। ठीक है?
Now inserting the nasogastric tube, you should first lubricate the tip of the nasogastric tube with the lignocaine jelly.
अभी कुछ नहीं होगा, अभी बस आपको गर्दन ऊपर की तरफ कर लो, ऊपर की तरफ बिल्कुल, ठीक है? ओके। बस निकलते जाओ, निकलो। इधर हो जाओ, मेरी तरफ से करो, बिल्कुल सीधा ऊपर, बिल्कुल सीधा।
गटको
बस ठीक है, चलिए।
So this is the most uncomfortable part for the patient. So if the resistance is met, just try rotating the nasogastric tube, which can aid up the insertion. And so you need to avoid forcing the nasogastric tube if significant resistance is being encountered. And if the patient becomes distressed, pause to give them some time to recover, and intermittently inspect the patient's mouth to ensure the nasogastric tube isn't coiling within the oral cavity. And the patient must be encouraged and guided to swallow this tube, which will decrease the resistance.
चली गई शाबाश गटको
ठीक है, चली गई।
And now we can continue to insert the Ryles tube down the esophagus.
ठीक है, बिल्कुल ओके। मार्जी वो दो एक।
And now once you reach the desired nasogastric tube insertion length, then you can fix the nasogastric tube to the nose with the dressing, as we are showing here, to make it to be positioned in the place.
कैसे लगते हैं?
The intragastric position of the tube must be confirmed after its initial insertion, and this must be documented in the patient's notes. There are various ways of confirming the tube's position. These are by the pH test of the content of the Ryles tube, and by the X-ray, or by just pushing up the air with an empty syringe and auscultating the air punch inside. That's all for now. Thanks for watching, and if you want to see more procedures, do comment down in the comment section below.